अस्सलाम वालेकुम, नमस्ते और सत श्री अकाल। मैं हूं नताशा और आज आप देख रहे हैं जी कंपेनियन। सबसे पहले मैं आपसे पूछना चाहती हूँ कि आपको सर्वाइकल कैंसर के बारे में पता है? आपको इसके बारे में जानकारी है या आपको इसके बारे में डायग्नोसिस मिली है? आज के शो में हम इसी बारे में बात करने जा रहे हैं, and I'm delighted to welcome a guest into the show who's going to be talking more in depth about cervical cancer, what it is, how you can get in touch, what can you do, and what exactly you can expect if indeed you are ever diagnosed. Our phone number is free phone. We're here for the next half hour. You can give us a call anytime on 0800 408 6700. But I'm delighted to welcome a lady who's not only a pioneer within this field, she's got a vast array of knowledge and experience. I'm delighted to welcome the one and only Dr. Adeola Olaitin onto our show. She's a consultant gynecologist as well as oncologist. So welcome to the show, Adeola. It's a pleasure to have you here on Z Companion with us today. Now, first question, which I know a lot of people are probably wanting to know, what exactly is cervical or cervical cancer?
So, cervical cancer is a cancer of the neck of the womb. So the womb is the organ that babies grow in, and the neck of the womb is the bit that opens so that the baby can come out. And that, like any part of the body, can develop a cancer, and that's what we're talking about.
Okay, and I'd like to know what, for the viewers at home, can it be cured? Is there a cure to it?
It absolutely can be cured, and even more importantly, can be prevented. It is a potentially preventable cancer.
Okay, and now a lot of people, and especially within the Asian community, are often quite scared of going for a screening. Now, firstly, I'd like to ask you, what exactly is a screening? Because we receive, and I'm sure many of you, like me, get letters through the post, sometimes a bill, sometimes an optician appointment, sometimes a doctor's appointment. Sometimes, if you're a bit like me, you just throw it to the side and think, I'm not bothered about it. If you're one like me, then this is something you certainly need to pay attention to. Now, why is that, Adeola?
So, I said cervical cancer is potentially preventable, and the reason why it's preventable is because before cancer develops, there can be some changes in the lining of the cervix, which are not cancer, but if they're not picked up and treated, can develop into cancer. Now, these changes don't cause any symptoms, so you wouldn't know there was anything wrong, and that's where screening comes in. So when you go for your screening test, some cells from the cervix are collected and they're looked at in a lab, and the vast majority of women will have a normal screening test. For the small proportion that get an abnormal screen, don't panic. It doesn't mean you've got cancer. It means you've got these very early changes that are completely treatable. And treatment is safe, it's effective, and it doesn't involve any long-term effects like loss of fertility or anything else. So you can see why it makes sense to go and get this screen done, because it protects you.
A lot of people will probably worry when they go for a screening. They probably worry as to what happens. You're saying screening. Now, previously it was known as a smear test or a pap test. What exactly is it, or what happens when you go for a particular test? Because obviously in the past, I know we've had this conversation, but in the past it was slightly different, and now things with technology, it's slightly changed. So for those who have a fear in themselves, what can you tell them? What assurance can you give?
So the first thing I'd like to say is that the test is very quick, and it's usually completely painless. We used to call it a smear because it involved using a small wooden spatula to collect the cells, and then they were put onto a glass slide. But now things have got even better. All you have is a very soft brush, and the cells are collected and they're suspended in a liquid. The liquid is sent to the lab and then it's analysed. So the test does involve the nurse or doctor looking at the neck of the womb with a small instrument, and the cells collected. It takes a few minutes, and then it's over for another 3 or 5 years.
Now, another worry that a lot of women, probably from the South Asian community, the majority of my viewers, I should say, worry. I'll be honest, when you go to the doctor, now I have a male doctor. He's fantastic, I swear by him. I think he's the best thing since sliced bread. But if I was to go for this test, or if any of my viewers were to go for a test, and they have a male GP, if they're not comfortable taking this test with a male GP, what can you do? What advice would you give to my viewers at home who are perhaps scared of without sounding awful, being poked and prodded by a male?
No, I can understand that, and I think most women would prefer to have the test taken by a female. I mean, most practices, it's the practice nurse that will take the smear anyway. But if you're particularly concerned, when you get your letter and you phone to make your appointment, make it clear that you want the test done by a female member of staff, and that request will always be granted.
Okay, and if for any reason, if a patient is ever told, no, you're only going to have Dr. X, for example, who's a male, what can you do after that? Where else can you go if you want to have the test done, but if, for example, your needs aren't met? I know it's a difficult question to be posed.
No, well, it's not. I just think, first of all, it's highly unusual because most surgeries do understand that this is quite a sensitive test. And, you know, it may be occasionally, maybe the practice nurse is on holiday or there are no female doctors available. Then sometimes the family planning clinic can do this test for you, and that's usually run by nurses. So there's always an alternative. But the wrong thing is not to have the test.
Right, okay. And how often is the test required normally? And in what age group should start worrying and think, you know what, I need to get the test done?
So screening starts from the age of 25, and you'll get your letter then. And it's every 3 years up until the age of 50, as long as you've had normal tests.
Okay.
And then after the age of 50, it becomes every 5 years until the age of 65, where if you've had normal tests, you no longer need screening and you're discharged.
Okay. And what about if, for example, a woman has been receiving lots of letters, go and get screened, you're due to get screened, go and get screened, and she sort of throws the letter to the side and thinks, I haven't got time, I'm busy with my children, with my job, my career, my family, my parents, whatever, and just kind of puts it in the back of her mind. What would you say to women like that who are perhaps just putting the letter to the side or binning it and putting it in their recycling bins? What would you say to them?
I would say to them, for the sake of your children and for the sake of your health, it's really important to have that test done. It's only an hour of your life, once every 3 or 5 years. And I know we're all like that. And when you feel well, especially, there's nothing wrong with you. You don't prioritise going to have a check done. But it is so important. I just think we're so fortunate in this country that it's available, that it's free, and that we're all entitled to it. So I think it's really important that we prioritise it. And as women, we prioritise looking after our own health.
Wonderful. Now, a question that I'd like to ask you, and this is one that I'm sure a lot of my viewers are sitting on the edge of their seats to ask and find out. What are the symptoms of cervical cancer?
So the things that should make somebody suspect that they might have cervical cancer is bleeding after intimate relationships, bleeding after you've gone through the menopause, or if you get a persistent offensive discharge. Now, the vast majority of women who have those symptoms will not have cancer, but it's important that you don't ignore them, because if a cancer is picked up early, then it's fully treatable.
Okay, and with regards to cervical cancer, there are a lot of different forms of cancer out there. You have lung, you have, cancer of the uterus, different forms of cancer. Now, some cancer or cancer genes or cells are indeed genetic. They can be passed down from a mother to daughter, father to son, or whatever. Is this something that can be passed down? Is it hereditary?
No, cervical cancer is not hereditary. It's more lifestyle related.
Okay, fantastic. We do have a caller on the line. Hello, welcome to Zee Companion. Who's calling?
My name is Mrs. Hussain.
Welcome to the show.
I'd like to make some comments.
Of course.
Yeah, I'd like to make some comments that I had this cervical cancer, and I was advised by the consultant that I should bring somebody with me to the hospital. I didn't have anybody at that time, so I took my daughter with me. The thing is, I didn't know what he wants to discuss about. I wasn't aware of that. He's going to break this news of me having a cervical cancer. So when I was there, he told me that you got some abnormal cells. I didn't know what abnormal cells were. So I asked him, and he gave me the detail that it's a sort of cancer. It's called cervical cancer. And I was devastated because the very first thing which comes to your mind is death. I'm going to die. I'm going to die with cancer. So what happened is I was more worried about my family than myself. So I'd like to say to the ladies, please don't ignore it. Just go and see your doctor, your GP consultant, and don't ignore for a minute. There is treatment, and I was given a treatment and I'm fine. But the thing I want to stress is that don't ignore it. I was much worried about my family, as most of the women are. Mother, whether you're mother or sister or wife, you are worried about others than yourself. So please, please go and see the doctor and also discuss with your family as well. And I'm sure there is treatment and you'll get better.
Wonderful. Mrs. Hussain, and how are you feeling now?
I'm all right. I'm feeling much better.
Good.
There's no cancer, no threat. I'm feeling much better. I'm okay.
That's wonderful. Well, we're glad to hear, Mrs. Saint, and thank you so much for calling us on Zee Companion and sharing your experience with us. Well, that's wonderful that we've got one of our viewers who's been through it, who's experienced it, and encouraging other people to actually seek help and go and get screened. I mean, I don't know, for those people who've just tuned in, we've been sort of really emphasizing how important it is to go and get screened. And recently we were talking, and I know we mentioned this earlier, that it's so important for people to move on and develop this. I think we care so much about how our hair looks, how our faces look, how our makeup looks, how our figure looks. But one thing we don't really perhaps give that much importance to is, I should say, the screening process. We think to ourselves, it's not that important, it's not that big a deal, but it actually is, especially within the case of Jade Goody, as I'm sure you remember. It was such a big thing. I mean, how did your department deal with it? I mean, it's become a huge case now whereby when it comes to cervical cancer, everyone's talking about it. Do you find that it's a great example to use?
Well, it's really interesting because it had an impact on screening. And what we did find was in the months following Jade Goody's unfortunate demise, a lot of people who'd ignored their screening letters came forward. And there was a huge increase in screening for about the year afterwards. And that was a good thing because it meant that a lot of people were saved from getting cervix cancer. Those who actually had a very early cancer were picked up and treated. So that made a difference. And I do think it's important. I think this program is excellent. Keep talking about it. Keep raising awareness in women.
Wonderful. That's great. Now, I need to ask you, when people go for a test or a screening, sometimes they may receive a letter which says that they have, and I'm quoting with air quotes, not being rude or disrespectful, but abnormal cells. What does that mean in medical terms, if you have abnormal cells? Does it mean immediately the person has cancer? And should one panic if someone receives a letter after having gone for a screening, you have abnormal cells? Does that mean that's it? You know, like Mrs. Hussain said, she thought that's at the end of the world for me. Is that what one person should think?
No, absolutely not. The first thing is don't panic, because the whole point in screening, we're not looking for cancer. We're looking for pre-cancer, which is fully treatable and prevents cancer. So normally if the letter says you have abnormal cells, what will happen is you'll be referred to see a specialist who will have a look and make a decision about whether these cells need treatment or not. And if they do, it's usually a simple outpatient treatment, same day, and most people will get up and go to work or do whatever they're going to do with the rest of the day after it's been done. So no cause for panic, completely within control, completely treatable.
Wonderful. Now I'm going to go to some of the emails. We have had our emails open to all of our viewers at home. Now the first one I got was from Kieran. Kieran says, I went for a smear test and my results said that I had HPV cells, but it's not serious. However, I am concerned. Can you please tell me what this means?
Okay, HPV stands for the human papillomavirus, which is a very common virus. It's passed through intimate contact, but it is not like other transmitted diseases. It's like catching a cold. Almost everybody would have come across it. And most people will get rid of it with their own immune system. So having the high-risk human papillomavirus itself is not something to be concerned about. It can't be treated. Your immune system will get rid of it. But it does make you more likely to have abnormal cells. And therefore you may need more frequent screening than somebody who has not got the high-risk human papillomavirus.
Okay. And it is treatable, as you said before.
It is. Your immune system gets rid of it.
Okay, fantastic. Now, I just want to reiterate for the viewers at home that if Adeola or I mention the word intimate, we are fully aware of what we're talking about. Intimate relationships between you and your other half. I know काफी सारे dads देख रहे होंगे, uncles देख रहे होंगे, नाना नानी दादा दादी, so हम लोग इसीलिए we're using the word intimate because we're fully aware as you know what we mean when we say this particular term amongst ourselves, because obviously we know that we have a wide audience here at Zee TV. Okay, so I need to ask you next, what is the PAP test? People often say pap test, pap test. What exactly is a pap test?
So PAP stands for Papa Nicolau, and way back then the first person who discovered that you can take cells from the neck of the womb, put it on a glass slide and interpret what is going on in the neck of the womb was a Greek man called Papa Nicolau.
Right.
But as I say, we've moved on from using a wooden spatula to put the cells on a slide, and now we use a liquid-based cytology solution. But it's the same thing. It's a way of screening for abnormal cells.
Okay. And now I want to ask you another question, because we're talking about cervical cancer. Is there any preventative measures? Is there anything a woman can do to prevent getting it in the first place?
Oh, there's lots of things that women can do. The first one, which is what I've been harping on about, is go for your screening test. The other thing, we know that people who smoke are more likely to get cervical cancer than people who do not smoke. So if you're particularly worried about your life, well, don't smoke. It's bad for you, full stop. But it particularly increases the risk of cervical cancer. And a healthy lifestyle protects most women. So a healthy diet, lots of fruits, lots of vegetables, and exercise keeps you fit. And if your immune system works well because of all these measures, then it protects you.
Does weight have any bearing on it? If you're overweight or underweight, can that have any bearing on it?
There is no recognised relationship between weight and cervical cancer. There is, being overweight can cause other types of cancers, but not this one.
Okay, I'm going to go to another email that we've had from one of my viewers called Aman. Aman says, I'd like to know, where can someone go for help and advice, aside from the GP, if they have been diagnosed with cervical cancer?
So if she would like more information, then there's lots of good information out there. I would recommend that she visits the Eva Pill website, for example, which has a lot of discussion about cervical cancer, and also you can talk to other women who've been through the experience, and that will help you to put it in perspective. And there are other similar charities who will give you advice and help and support.
Are there any counselling services that are available for people who do suffer from this form of cancer?
There are. They're usually accessed through the treating centre. So if you're being treated for cervical cancer, you'll usually be treated in a specialist cancer centre. And there are two types of support. You'll have a clinical nurse specialist, and you will also have access, if you need it, to psychological counselling.
Wonderful. Well, we do have another caller on the line. Hello, welcome to Zee Companion. Who's calling?
My name is Anis.
Anis, welcome to the show.
Thank you. I'd like to ask a question. 2 years ago, I had lichen sclerosis. And with that, it's left a very itchy vagina of mine. And I don't know whether I've got cancer or what.
Adeola?
Is there a treatment for it? Or I really don't know. I've had a scan and nothing has come out of that, but I can't get rid of that itchy and like a smelly discharge from there.
Okay, so lichen sclerosis is a problem of the skin on the outside of the genital tract, and it can cause exactly what you're describing: discomfort, itching, and pain. It's important that is seen and treated, and usually either a specialist gynecologist or a dermatologist will treat this for you. It's usually treated with steroid creams. I'm assuming that you've seen somebody, had the diagnosis and been treated.
Yes. I've had, and I use Dermaweight for it.
Okay.
But the itching and all, the discharge hasn't stopped.
I would recommend, therefore, that you go back and see your specialist so they can re-examine you, because they may want to use a different combination of creams for you. Does that help?
Thank you very much.
My pleasure.
Anis, thank you very much for your call. We hope you find some comfort. No problem. You're welcome.
Grateful.
Right, we've got another caller on the line. Hello, welcome to Zee Companion. Who's calling? Hello? I think we got disconnected there. No problem at all. Just to remind you all that Adeola is indeed here in the studio for only half an hour. अगर आपका कोई भी सवाल हो, कोई सवाल छोटा या बड़ा हमारे लिए नहीं है, you can give us a call. Our number is 0800 408 6700. Now, another question I have for you is, if a person gets diagnosed with cervical cancer, and what is exactly, and they say, yes, you've got it, you go to see your GP, you receive the letter and confirmation, what are the treatments? I should say, what are the effects of the treatment on a person?
Okay, so the treatment will depend on the stage at which the cancer is diagnosed. If it's very early cancer, then the treatment could just be removing the little area of the cervix where the cancer arises. And under those circumstances, the effects are very few, you can preserve fertility, you can still have children, and you will just need to be followed up by your treatment centre. A more advanced cancer may require an operation called a radical hysterectomy, which involves removing the cervix, the womb, and the areas around the womb, and clearly that has an impact on fertility. And even more advanced cancers will need treatment with a combination of radiotherapy and chemotherapy.
Right.
The important thing is that all of those treatments are effective, and all of them can potentially cure the cancer. But obviously, the earlier the cancer is diagnosed, the less severe the treatment will be, and the less impact on your life and your lifestyle it will have.
Of course. Thank you so much. We've got another caller on the line. Hello, welcome to Zee Companion. Who's calling?
Oh, hello. My name is Rosie Khanna.
Welcome to the show. What's your question for Adeola?
Hello.
Hello.
My name is Rosie Khanna.
Yes, Rosie, we can hear you. Can you just turn your TV volume down for us, please? Because we can hear you perfectly here.
Yeah, so just 1 second.
It's okay, no problem at all. It happens all the time on live TV, we understand.
Yeah, okay. My question is, I haven't had a smear test for about 20 years or so, purely because my GP keeps telling me that I don't need one because I had a hysterectomy. My worry is my ovaries weren't ever removed. So the problem is he doesn't make me feel comfortable about it, because every time I raise this question with him, he says, I think you don't need one. It's the question think which gets me. I just need a little bit of clarification on it, please, if you don't mind.
Okay, that's a really pertinent question. If you've had a hysterectomy, that means that the cervix has been removed, which is the neck of the womb, and therefore you don't need smears. The ovaries, you don't need smears, so you can relax about that, because you haven't got a cervix.
Okay, so it doesn't affect the ovaries?
No, the ovaries are a completely different organ, and the ovaries are not susceptible to screening because they sit deep inside your pelvis and you can't reach the ovaries. If you're concerned that you have symptoms suggestive that your ovaries might be causing problems, then the way to look at the ovaries is to have an ultrasound scan. So you don't need smears.
I don't need smears.
Yeah.
Thank you so much.
It's my pleasure.
Thanks for your call, Rosie. Much appreciated. We've got another caller on the line. Hello, welcome to Zee Companion. Who's calling? Hello? No, I think we don't have a caller. They're not a problem at all. I think they must have dropped the line. But this is an interesting question. Now, you were actually here with me on my 5:30 segment, and I think for the purpose of our viewers at home, I hope you don't mind if we reiterate the question. Now, I asked you what was the difference between cervical cancer, which for the viewers at home, that's what Jade Goody, the celebrity from who made her name from Big Brother, she indeed suffered from. And what is the difference between cervical and ovarian cancer, which many of you remember or should know, the Bollywood actress Manisha Koirala, she had that. We'll just talk about that in 1 second, but we do have one caller on the line. Hello, welcome to Zee Companion. Who's calling?
Hello.
Hi, welcome to Zee Companion. Who's calling?
My name is Madhuben Patel.
Welcome to Madhubenji. What's your question for
My question
Adeola?
is, doctor diagnosed my lungs fibrosis. I want to know, is a cancer or not?
Sorry, can you repeat the question again for us, please? We had a bit of an issue hearing you.
Yeah, I got fibrosis. Is that is a cancer?
Fibroids.
Fibrosis.
Fibrosis.
The lungs.
Fibrosis?
They diagnose fibrosis.
Fibrosis of the womb?
Lungs.
Of the lungs. Okay, no, it's not it's not lung cancer. It's scarring in your lungs.
Yeah, they said fibrosis.
It's not, fibrosis is not cancer.
They gave me the oxygen and all, you know.
Oh, bless you. Well, please don't worry, because as Dr. Adeola just said, it's not a worry about, okay? Thank you very much for your call. Now, if you can please just quickly define the difference between ovarian cancer and also cervical cancer.
So as I said to the previous caller, they're two separate organs, the cervix and the ovaries. The ovaries are the things that produce eggs in women. There are two ovaries. Each woman has two ovaries, and they sit deep inside the pelvis. The cervix is the neck of the womb. The womb is the organ in which babies grow, and the cervix is the bit that opens up so that babies can be delivered. So a cancer of the cervix, or cervical cancer, is one that arises in the neck of the womb. Ovarian cancer is a cancer that arises in the ovaries. So they're completely different. They behave differently. And ovarian cancer is not what we're looking for when you go for a screening test.
Wonderful. Thank you so much. I'd like to take this opportunity to thank all of you who've got in touch with us throughout the show. I hope we've answered all of your questions. I'd like to thank Adeola Olaitin for being on the show and answering all your questions. I really do appreciate it. And you've been so insightful with your knowledge, experience, and definitely advice to my viewers at home. Now, before we love you and leave you for today's show, I have to remind you of a few things. There are 3 things you need to remember. First and foremost, don't be scared, especially when it comes to taking the test. Koi darne ki baat nahi hai. It's something that every woman should do as long as you're over the age of 25 and get the letters. Please do go and get yourself checked out. Second of all, please don't be embarrassed. Bilkul sharmane ki koi baat nahi hai. It's something that a lot of women go through, and it's something that you must definitely pay attention to. And thirdly, last but not least, but the most important, do go and get screened. It's something that's very important and something that we cannot emphasize enough here at Zee Companion. So that's it for today. I'll be back again tomorrow's show and we'll be talking all about diets, yes, how to lose all that weight, how you can look fabulous for the summer, and a lot more. Have a great day, and from all of us at Zee Companion, have a great evening.